Hi everyone, this is Dr. Raj Kapadia, oncologist from Fortis Hospital's Mulund. Today we are going to talk about lung cancer. So let's break it into simple parts. First, let's talk about the clinical symptoms. Then let's talk about the tests which we need to do and then the treatment plan. So to begin with the clinical symptoms, the symptoms can be something like a chronic cough, chest pain or hemoptysis or blood in cough. These are very subtle signs and most patients miss, thinking in terms of that it could be some allergy or some cough which is not getting corrected. So it's very important that as soon as you have these symptoms, you definitely do a chest x-ray and meet your doctor in case there is any further investigations required or it feels that it could be cancer. Then we can evaluate accordingly. Now coming to the investigations, the CT scan is a simple and the most commonly used test for diagnosing lung cancer. Once it's diagnosed, it's important to biopsy it because not all lung masses can be cancer. It could also be tuberculosis or some other infection or fungal infection. So a biopsy becomes a crucial step in the management of lung cancer, which is done easily today with a CT guided biopsy. Previously it was very difficult to get, but now it's a very commonly done procedure and without much complications. Once we have the biopsy of the lung cancer, then we do a PET scan to stage the lung cancer and MRI brain as well, because lung cancers are known to spread into the brain. Once the adequate staging is done, then we plan for the treatment. Generally, in stage 1, stage 2 lung cancer, surgery is the first line of treatment where you do the surgery first. Now, the surgery can be done in a minimally invasive way with a VATS surgery or a robotic surgery, which makes your recovery and your outcomes improved compared to the previous or standard open surgery. It's important that we diagnose lung cancer early because the earlier stage, surgery could just be enough for your treatment. But if it's stage 3 and beyond, then we need to give some form of chemotherapy first before we try to do the surgery, which makes it a little more difficult to treat, and sometimes surgery cannot be offered to these patients. So just to conclude, that lung cancer is very, very treatable if you present early and we diagnose it early. So do not neglect your small symptoms thinking that they are not important. Give importance to your body, your symptoms and your health over everything. Thank you.